1 2 3 1 2 3 Ada. Sila A 3 2 1 dicoba. 1 2 3 3 2 1 dicoba mic wireless 1. Ada. Sila A ha cik le A. Kang, yang dari situ kirimannya yang ke ini udah dibuka. Sila A cik cik le A. Hei le A. Ada ya? 1 2 3 3 2 1 dicoba. Le A cik le A ha cik le A. C le A ha. Dah. Satu dua tiga dua satu. Ini mic-nya ibu ya? Ada nggak? 1 2 3 2 1 le A ha cik le A. Ada ya? Nomor berapa, Bro?
Minister of State-Owned Enterprises. Minister Thohir will share with us on the role of Indonesian state-owned enterprises in mitigating COVID-19 and how Indonesia plans to strengthen its national resilience on health security. And of course, today we also have Professor Wiku Adhisasmito, and as usual, Professor Wiku will enrich us with details and technical information. Let me start by updating you with some issues related to COVID-19 from the perspective of the foreign affairs. Colleagues, on the 4th May 2020, President Joko Widodo participated in the virtual summit of Non-Aligned Movement or NAM under the theme of United Against COVID-19. Around 40 countries participated in the summit together with the Director General of the WHO, while the Secretary General of the UN also participated through a video message. From the meeting, several important messages were underlined. First, the Bandung Declaration of 1955 has become the spirit of the movement and remains relevant until today. Second, the summit underlined the importance of multilateralism, cooperation, solidarity, and support to the work of WHO. Third, the summit underlined the principle of healthcare for all, which include access to affordable medicine for developing countries. And this is also very important for the attainment of SDGs. Fourth, stress the need to strengthen international partnership through exchanging information, scientific knowledge, and best practices, and by applying relevant guidelines recommended by WHO. The summit also agreed to establish a task force to set up a collective database containing health, social, and humanitarian needs to mitigate COVID-19. This database will be submitted to all donor countries, international humanitarian organizations, international financial institutions, and transnational private entities for possible support and assistance. 3 points that President Joko Widodo mentioned during the NAM summit. First, the importance to strengthen political solidarity between countries. Second, realization of political solidarities through concrete cooperation, especially to ensure access of affordable medicine for developing countries. Third, strengthening partnership among developing countries, among others, through provision of humanitarian assistance, development aid, debt relief, as well as debt swap for COVID-19 from official creditors. In particular, on vaccine issue, President Joko Widodo underlined that we must not leave developing countries behind. They often encounter various challenges due to high price of vaccine. Therefore, in line with Indonesia high call in all international forums, we must strive for equitable and timely access to medicine and vaccine to cure COVID-19 with affordable prices. Furthermore, we also need to look into the use of relevant flexibilities within patent regime and explore other innovative solutions. That is my first issue, colleague, on the result of non-aligned movement summit. Now my second issue is not directly related to an effort in fighting the virus, but on the recent situation in the region and to be more exact, the situation in the South China Sea. I wish to emphasize 5 points. First, Indonesia continues to follow closely recent developments in the South China Sea. Second, Indonesia expresses its concern on the recent activities in the South China Sea, which may potentially escalate tension at a time where global collective efforts is vital in fighting COVID-19. Third, Indonesia underlines the importance of maintaining peace and stability in the South China Sea, including to ensure freedom of navigation and overflight, and urge all parties to respect international law, particularly the United Nations Convention on the Law of the Sea, UNCLOS 1982. Fourth, while negotiation of COC is being postponed due to COVID-19, Indonesia calls all relevant parties to exercise self-restraint and to refrain from undertaking action that may erode mutual trust and potentially escalate tension in the region. And fifth, Indonesia believes that conducive situation in the South China Sea can support the COC negotiation process. Therefore, we remain committed to ensuring the conclusion of COC that is effective, substantive, and actionable despite the current circumstances of the COVID-19 pandemic. My third and last issue is how we and all the stakeholders in Indonesia are working hand in hand in addressing COVID-19 and its socio-economic impacts, including, of course, the involvement of the Ministry of State-Owned Enterprises. Colleagues, even before the first cases of COVID-19 emerged in Indonesia, I have been working very closely with Pa Erick Thohir. We have worked closely together, especially to facilitate the attainment of medicine and medical supplies from many countries and stakeholders, and also developing capacity of Indonesia health industry. These collective efforts are expected to contribute in developing our national resilience and self-reliance. In fact, our state-owned enterprises were the first responder in securing supplies of priority medical devices and medicine. I do believe also that state-owned enterprises could play a significant role as a prime mover at home and within our international cooperation. On this note, colleagues, I have the honor to invite Pa Erick Thohir, the Minister of State-Owned Enterprises, to convey some updates, and then after that will be followed by Professor Wiku Adhisatsmita on other related updates. So, Pak Erick, the floor now is yours. Silakan, Pak Erick.
Thank you, Ibu. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, fellow journalists and respected guests who are present here. Minister for Foreign Affairs, Ibu Retno Marsudi. Thank you for all who are gathering today. Although the COVID-19 pandemic has been a disastrous force in our life, it has become an opportunity for us as a nation to build a better and stronger healthcare infrastructures. Our strength, compassion, and humility will allow us to face and resolve this pandemic together. Today, I will share what Minister of State on Enterprise has been done and what we'll do in the near futures. First, review the ministry contribution to mitigate the spread of the virus. Second, elaborate on the ministry trace, test, and treat program to tackle COVID-19. And lastly, explain the ministerial agenda in developing a strong and balanced state enterprise health industry. The Ministry of State-owned enterprise has been a key partner in the government's effort to control coronavirus outbreak. Our state-owned banks, Himbara, has helped restructures over 830,000 debitors with a total credit value of 120 trillion rupiah, which dominated by micro, small, medium enterprise in sector credit. PLN, the national electric companies, subsidize electricity for 30.9 million customers. The ministry has secured the availability of rice, sugar, and meat to maintain food stocks and staples during the COVID-19 pandemics. In collaboration with Minister of Foreign Affairs, Garuda Indonesia has conducted 30 flights to carry medical equipment and pharmaceutical aid from neighboring countries and 4 flights for repatriation Indonesian citizens. To handle COVID-19, the Ministry of State-owned enterprise have adopted a trace, test, and treat approach to gain an early edge on the situations. Trace. Our ministry has collaborated with the Communication and Information Minister to develop a mobile app that enables users to compile data related to the spread of COVID-19 in their communities. The Peduli Lindungan app has bolstered the government efforts to trace and track confirmed cases with 3.5 million users as today. On the test, in terms of testing, the ministry produced 19 PCR machines to be used in state-owned enterprise hospital and regional hospitals. This is also with the effort from my dear sister, Minister of Foreign Affairs of Indonesia, Ibu Retno. Bio Farma is also planning to produce up to 50,000 PCR diagnostic kits in the second week of May. Moving forward, they plan to increase the capacity of producing 50,000 test kits per week. Treat. The minister has allocated 70 hospitals to treat COVID-19 patients, which is 35 of them are active. Over 2,300 are being used for active cases. Moreover, our state enterprise are working hard to produce the much needed medicine and the medical equipment for the treatment of patients and protection of the healthcare workers. Under the supervision of Minister of Defense and also the Minister of State-owned Enterprise, PT Land and PTDI is also collaborating with State University to produce local ventilators. Aside from hospital and medical equipment, we also have directed our efforts in the development of vaccine. Our pharmaceutical enterprise and Agency for the Assessment and Application of Technology, BPPT, alongside private sectors and government agencies, aim to develop a vaccine as soon as possible. They are also working with international organizations. The pandemic has been a learning process for us all, including we in Indonesia. The minister has assessed that the Indonesian health industry is vulnerable, as it is highly dependent on other countries for medical technology. Nevertheless, there is an enormous potential for growth. Our agenda, together with the Minister of Health, will shift to prioritize national health security by encouraging joint research and production in Indonesia. In the short terms, we have formed a pharmaceutical holding company and consolidated 70 state-owned hospitals and formed a health cluster to establish a coherent supply chains between state enterprise in the health sectors. In the medium terms, we will continue focusing our efforts to improve the nation's R&D capacity for vaccine and therapeutic medicine production. In the long term, we aim for our pharmaceutical company to become global company that effectively promotes being well-being of all people and deliver sustainable impact in Indonesian healthcare. Conclusion, the crisis has devastated many and is a force to be reckoned with. However, by turning the tides of crisis into one of opportunity will allow us to march on forwards with our health high. As such, the Minister will continue to 1. Build infrastructures and introduce new tools to monitor the health progress of the individuals. Number 2. Work closely with other ministries, private companies, and international organizations. 3. Actively continue to the global discussion on managing health crisis. Most of all, I would like to thank the Indonesian citizen for abiding to our policy, as we could have not done without the support of every individual at home. The government of Indonesia will continue to fight to help those in need. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Thank you, Ibu Retno Marsudi, Minister of Foreign Affairs, and also Pak Erick Thohir, Minister of State-Owned Enterprises. Good afternoon, the international media colleagues. Thank you for joining us. I'm Wiku Adhisa Smito on behalf of the National Task Force for the Acceleration of COVID-19 Mitigation. I would like to state some important issues. First is that Indonesia is known as hotspot for the emerging infectious diseases and never taken light steps in battling it. Throughout the years, the country has learned about the mitigations and strategies to respond diseases such as avian influenza and also SARS. The formation of the Task Force for the Acceleration of COVID-19 Mitigation, or Gugus Tugas, established on March 13, is a prompt and strategic response to the COVID-19 global pandemic that has emerged as a confirmed case on the 2nd of March. The government of Indonesia received many inquiries from the media, amongst those including articles, opinions, like that has been published, such as from the Carnegie Endowment. The task force itself, unlike what many people believe, are only consisting of certain elements of the nation, even as far as stating relying on military personnel and keeping political scoring on policy making. I should say this is a single-sided, irresponsible, and misleading statement. The task force is built based on aligning all ministries, local governments, and related communities involved. For example, the Ministry of Home Affairs, Police, and Military are structured up to the smallest community. All are integrated into the National Task Force, and we respond well in comparison to other countries. We are streamlining data collection and health systems as strengthening efforts. The government now speaks with one voice, making data guidance, and government statements available hourly in at covid19.go.id. There are only few countries in the world that has formed a unified task force in COVID-19 mitigation. As global citizen, our participation in disseminating evidence-based facts is urgently needed. Besides our campaigns to shift Indonesian new habits, we are also constantly trying to ward off hoaxes to maintain national stability and security. Because we need to make sure the news circulation is far from subjective opinions. The role of media is an important key, but if not using the right data, it can be misleading. Because we need to make sure the news circulation, again, is far from subjective opinions. We strongly suggest that all international media colleagues be in line with our mission. Maintaining trust and credibility and actionable information available to the public is essential in fighting this perang semesta. It is a war for all. Back to Ibu Retno. Thank you.
Well, thank you very much, Pa Erick Thohir, and thank you very much, Pa Wiku. Colleagues, now we move on the Q&A session. We have received questions from 11 media: Channel News Asia, Taiwan Central News Agency, Nikkei, Australian Financial Review, ABC, Morocco Press Agency, Manishi, CCTV, Al Jazeera English, and Deutsche Welle. And thank you very much, colleague, for those questions. Minister Thohir, of course, will answer question related to state-owned enterprises, whereas Professor Wiku will provide once again updates and technical data. So for my part, I will address two questions related to two issues. The first issue is about the international cooperation, and then the second one is related to Indonesian abroad and foreign nationals in Indonesia. Colleagues, I believe that I have already addressed two questions in my previous presentations regarding President Widodo high call for equal access to medicine for developing countries, and the question on Indonesia that is raised by Deutsche Welle, DW, as well as on the Indonesia position on the increasing activity in the South China Sea raised by Australian Financial Review. Therefore, allow me to respond the question from Moroccan Press Agency and DW in regard to the latest development of international cooperation for COVID-19 mitigation. To date, Indonesia has collaborated with 101 international partners, comprising of 9 countries, 10 international organizations, and 82 NGOs. And then to answer question from China Central Television on Indonesia cooperation with China, I would like to underline that Indonesia cooperation with China in addressing COVID-19 pandemic is mutually beneficial and robust. It is actively conducted at G2G level as well as among non-state elements, including businesses. It is developed and implemented not only through bilateral means, but also via regional mechanism as demonstrated by our cooperation in ASEAN plus 3 Special Summit on COVID-19 and then ASEAN-China Special Foreign Ministers Meeting on COVID-19 and China participation in the ASEAN plus 3 Emergency Rice Reserve. And then responding to ABC question on the issue of returning Indonesian crew, particularly number of returnees from where and then where they have docked, I would like to inform you that as of yesterday, 5th of May, there are 12,990. I repeat, 12,990 crews have returned so far. They are coming from 21 countries and working in 80 cruise ships. Yesterday, 29 crews arrived. 203 crews arrived on 4th of May and 468 crews arrived on the 3rd of May. They have disembarked through dedicated entry points such as Ngurah Rai Airport, Soekarno-Hatta Airport, Tanjung Benoa Port, and Tanjung Priok Port. And then answering the Mainichi question regarding the current legal status of Jama'ah Tabligh in India, I would like to convey that first of all, the total of Jama'ah Tabligh from Indonesia in India is around 727. As of yesterday, 5th May, 276 Indonesian GT in India have been reported to police due to alleged violation. I repeat it again, due to alleged violation against quarantine and immigration measures. Out of these 276, 138 Indonesian GT in India are in judicial custody and are due for legal proceeding. This is not an easy situation, colleagues. Therefore, since the very beginning, we pay attention on their situation. President Widodo brought this issue to PM Modi during their phone conversation, and I myself brought also this issue with Foreign Minister of India. To address this, the Indonesian mission in India continue to closely monitor their well-being, intensify communication with the representative of Jama'ah Tabligh from Indonesia and India, intensify communication with Indian authorities, and also provide consular and legal assistance. And then answering the question from DW regarding our nationals in Europe, Indonesian citizens in Europe. Out of 21,480 Indonesian living in Germany, there are 10 positive cases, 6 have recovered, 3 are under care, and 1 recorded death. Through all our mission abroad, including in Europe, protection of Indonesian citizens is our priority. We also monitor development and their well-being with the assistance of local Indonesian communities abroad as well as through online platform. Apart from the cruise ship crews, those who study and have long-term work contracts remains in Europe. And lastly, responding to Mainichi question on foreign nationals in Indonesia who are COVID-19 positive and death reported, I would like to convey that as of yesterday, 5th May, there are 590 COVID-19 cases of foreign nationals in Indonesia. 92 are positive, 314 314 are people under surveillance, or we call it ODP. 164 have recovered, 17, I repeat, 17 deaths have been recorded, and then 3 unconfirmed cases. So I do hope that I have answered all your questions related to my portfolio. And now I give the floor back to Pak Eric to respond to the question related to the portfolio of Pak Eric. And then after that, again to Prof. Wiku. Pak Eric, silakan.
Thank you, Ibu Ratna, for the time. So I would like to apologize to many of journalists who are also give some question related to the performance of the state-owned enterprise, most of them on the corporate sectors. I do promise to all of you in the next 2 weeks, we want to have our own session to have discussion and to have a question answer on these related issues. For the time being, I will only answer some of the question that related to COVID-19. If I try to categorize, there is two, I have 3 questions, but I can say I can categorize two, basically one more related on the raw materials and also uh, on the issues of raw materials, drug manufacturing, and also pharmaceutical industries. And the other issue is more related on the epidemic situation on the state-owned enterprise performance. So basically, if I can explain to most of you, again, like I mentioned at the beginning, thank you for the help of many countries that has been supporting Indonesia. Not only that, also many private sectors actually is been giving a lot of donation to what we needed in facing on COVID-19 pandemics. As a state-owned enterprise, we try to anticipate this issue at the beginning around 2 months ago. Yes, we are understand 90% of our raw materials in terms of medicines is imported. This is why since the early stage of the pandemic 19, we try to secure the raw materials for many medicines that we are need to produce. Many of this raw material for the medicines we get from India. Some of the PPE, we get it, the raw materials from Korea and from Taiwan. But of course, as you understand, as the state-owned enterprise, we don't have any company who are producing this PPE. More are from the private sectors. The state-owned enterprise produce mass, which is the raw materials. In early stage, we got it from China because China locked down that times. Then we find another sources from India. In terms of ventilators, many of the sources we receive from India, but of course some is US brand who are producing from China. But as I mentioned on my presentation before, this is something that the situation that our president are concerned. He make a big statement today during the meeting around our ministers level that starting next year, Indonesia want to make sure also on the health security issue become less dependent from other supply chains from the other countries. This is why State on Enterprise, we try to help and lead these changes, working together with the Minister of Health and also the Minister of Educations to make sure that in the futures we can produce our pharmaceuticals industry by our own, but at the same time we are welcome to international partners who wants to be our partners to develop Indonesia health industry. And the last one, actually, the question more to impact on the state on enterprise performance. I will say I cannot deny, similar to other private sectors, many of state-owned enterprise corporation are affected to this pandemic. For example, the infrastructures, the tourism sector are infected. This is why actually we as the state-owned enterprise already have a clear roadmap regarding three issues that we want to be less dependent to the supply chains of the global in terms of three. Number one, on the health security issues. Number two, on the energy issues. And also the last one on the food security. But of course, I can give a further explanation on the other time in 2 weeks. My team will organize this similar session with all the international journalists. I think that's from me. Thank you. Please, Prof. Ito.
Thank you, Pak Eric. Now I would like to address several questions from the media. There are 10 questions. I'd like to answer it uh, as short as possible. First is from the channel News Asia. Pak Doni mentioned on Monday that there are provinces with 0 new cases. However, some regions say they have problems conducting PCR tests and that a flat curve does not necessarily mean there are no new cases, but it is due to pending swab tests or the results. I'd like to respond to this. WHO has updated the COVID-19 reporting standard in early April that includes suspect and probable cases. We are in the process of collecting, cleaning, and integrating data from provinces and districts. Indonesia is the 4th country with the largest population in the world. It cannot necessarily be compared to a country with a high economy and low population. Indonesia's test ratio per population could not be compared automatically with other countries which had different geographical and economic strengths. After the data integration, hopefully, we are able to report the situation. There is going to be some changes and revisions of the overall data. As the head of the task force instructed, all accurate data are expected to be shown as it soon. The second question is also from Channel News Asia. Pak Doni Monardo has said the delay in testing was because of the shortage in human resources. How many more personnel is needed and how soon are you able to get this manpower? We are working our best to enhance the number of the human resources in laboratories by collaborating with WHO to provide training for laboratory personnel regarding RT-PCR testing procedures. This training will be conducted in 2 batches this month with more than 100 participants joined from testing laboratories around the country. Hopefully, by the end of this month, all laboratories will be fully supported by trained volunteers so we can keep the maximum amount of testing per day. The third question is from Taiwan Central News Agency. In the WHO latest report about COVID-19 in Indonesia published on April 30, it says that the number of persons tested for COVID-19 was 4,567, while Mr. Wiku said on the same day at the media briefing that the testing capacity has reached 10,000 per day. Does daily testing capacity mean the number of persons tested per day? Why is there such a difference between the two? Can the government also publish daily testing cases on related websites? Our response is the government through the Gugus Tugas aimed and have reached the maximum capacity 10,000 tests per day by supporting the laboratories regarding procurement of laboratory supporting tools, i.e. PCR reagents, RNA extraction reagents, VTM, and also the swab. We have distributed more than 450,000 reagents across Indonesia, but the actual tests that are conducted are varied every day. Our laboratories are evolving for the better every day. Right now, the task force has also collaborated with the Indonesian Doctors Association, or ED, to support distribution and the capacity of the lab diagnostic at the local level. We are hopeful of this partnership and looking forward to what we are able to accomplish. This one of the true forms of pentahelix collaboration. The fourth question from Moroccan Press Agency. Why has the COVID-19 cure rate improved significantly lately? How many tests does Indonesia currently perform per day? How the world has viewed this mitigation is with massive testing. That method might work better with smaller countries with less population. With our country coordination, we are looking for alternatives in finding out the burden of the disease in a different approach, assessing it with different methods as opposed to massive testing. This is one of the roads that Indonesia has taken in order to find the right method of mitigation given the population distribution and density. One of the best experts for survey in Indonesia voluntarily joins with us recently, developing different methods in the sampling test for COVID-19. We expect to conduct very soon. The sixth questions from Moroccan Press Agency. What are the different scenarios after the epidemic crisis in Indonesia after the 1st June? Our response, depending on the country situation, each country has different approaches. Each peak that the other countries have gone through, we are also learning from them. We monitor how there is a case resurgence after the lockdown is lifted. Such things happen even in advanced countries like Japan, specifically Hokkaido. Learning from other countries, Indonesia has adopted policies that are appropriate to the circumstances and characteristics of the Indonesian state, which consists of several islands. Indonesia wants to prevent a second wave of COVID-19, so the government is currently developing an in-depth analysis of the next normal community behavior patterns that can be applied after a pandemic. The sixth question is from Moroccan Press Agency again. During these epidemic situations of COVID-19, our dengue infections are still under control in Indonesia. I'd like to say that during the first quarter of 2020, there were increased cases of dengue fever in Indonesia. Therefore, the government continues to provide best health services in order to control and tackle non-COVID diseases such as dengue fever through a preventive approach to prevent spikes in the dengue cases. The seventh questions from Mainichi. Why are there many medical staff doctors who died in Indonesia? Up until today, there are approximately 38 doctors and 17 nurses that have died. There are no words that could express such sorrow in remembrance of our medical heroes. I consider this a homework that has to be fixed and to be strengthened by the Society of the Public Health. We need to shift the focus. Many parties focusing on health put the wrong focus only on the treatment, but not at the prevention and health promotion stage. Meanwhile, behavioral changes toward a healthy lifestyle that promotes good individual hygiene by a massive education approach is a very important key to cut down the spread of this COVID-19 virus. According to an article titled Lessons from the Death of Doctors and Nurses from COVID-19 Worldwide, an analysis and a tribute, several amount of factors contribute to the increased risk of health workers getting infections of COVID-19 virus. Some example factors are first, unawareness of healthcare workers that their patients who were being treated unfortunately had COVID-19. Most of the time, it is worsened by patient dishonesty to tell about their history of present illnesses as well as travel or contact history. This leads to the late precautions protocol being performed. Second, underestimating the pandemic. The third, shortage of personal protective equipments. The fourth is the PPE misuse healthcare workers. The fifth is the healthcare workers fatigue due to long working hours for each shift. And lastly, invasive procedures such as emergency intubation being performed by the healthcare workers. The eighth questions, this is a bit different from the ABC, asking about the wet markets that sells extreme animals like in Tomohon Market, North Sulawesi. Do you believe that sales of pets should be stopped nationally? Why is there no ban for sale yet given the possibility of virus coming from pets? We respond to these questions that the market is like the cafeteria of the animal pathogens. By consuming wild animals, same as playing with fire. There is high risk that needs to be controlled when interesting wild or extreme animals. For instance, if the host of the virus is the bat's body turns out to be appropriate in the human body, then it has the potential to infect humans or also known as zoonotic disease. Therefore, maintaining our immunity, always keeping clean, and stopping consumption of wild animals can be the important factors as precautions taken. In addition, we have warned the Ministry of Agriculture and the Ministry of Environment and Forestry to coordinate and strengthen the surveillance capacity, conduct further research on viruses or genomics, and most importantly, to conduct massive campaigns and analyze policies to limit or stop consuming wild animals. The ninth questions from Channel News Asia again. President Joko Widodo said there are about 89,000 Indonesian migrant workers who have returned. How many of them have become imported cases of COVID-19? We are keeping a close look on all aspects of people's mobility, including the status of the 89,000 Indonesian migrant workers. In close coordinations with the Ministry of Foreign Affairs and Ministry of Transportation regarding the mobilization, when the workers depart from each country, the moment when they depart and arrive, we conduct screening protocols and monitor the migrant workers under surveillance by providing quarantine facilities and social assistance. With a total number of Indonesian migrant workers about 113,704 persons, 185 persons become imported cases, according to data by 1st March until 5th May of 2020 by the Ministry of Health. We also coordinate and cooperate closely with the Ministry of Health to strengthen surveillance and with the regional task force in monitoring those migrant workers when they arrive in their area. The last questions from Taiwan Central News Agency. How does the government evaluate the effectiveness of PSBB? At what point would the government consider more coercive measures to restrict movement? Currently, the government has set rules regarding prohibition of mudik for Indonesian people. That move is expected to be able to cut the transmission of the virus. The latest presidential directives related to the COVID-19 pandemic handling, in which provinces and regencies and cities that apply the PSBB to be monitored and implemented strictly and effectively. Every region that carries out PSBB must have measurable targets and continue to monitor closely the potential distribution in several clusters in the regions. This is all the answer I can give on this occasion. Again, I would like to emphasize the three important key points on battling pandemic. First is prevent, the second is detect, the third is response. During these 2 months, Indonesia has been able to improve capacity within this area, and currently there are initiations to study coronavirus in Indonesia. One of the breakthroughs in detecting the latest results is the Ekman Institute reports on whole genome sequencing of 3 people who were infected by coronavirus in Indonesia. Furthermore, profiling of other coronaviruses will continue to be sought in the hope that we can find out the holistic profile of coronavirus in Indonesia. And multi-center research must be driven. It is a form of strengthening national and global health security. Thank you. Now I return it to Ibu Retno.
Well, thank you very much, Pa Eric, and thank you very much, Pa Wiku. Colleagues, this is the end of our press briefing for today. Once again, thank you very much for participating in this press briefing. Inshallah, I'll see you next week. And don't forget, stay strong, stay healthy, and stay united. Thank you.